Living with a chronic condition is difficult, especially when the science is still evolving.
I first started feeling pain symptoms about 6 years ago. It just hit me out of nowhere. I was doubled over in pain and was taken by family to the emergency room. You feel crazy. You feel pain, you know something's wrong, but no one can find out what's wrong with you. It's frustrating. Either 3 or 4 years later, I called Dr. Lamb and she scheduled surgery. There was endometriosis everywhere.
Endometriosis is a special problem where lining tissue from the uterus, the endometrium, is growing in places where it's not supposed to be. So each month at the bleeding time of the menstrual cycle, that tissue also bleeds. A lot of times, diagnosing endometriosis is a matter of really listening to somebody's symptoms. The main definite way to make a diagnosis once we have a suspicion based on the symptoms is to do a laparoscopic surgery to look inside the belly.
When she told me that there was a cause for my pain, I felt validation. I'm gonna try everything I can to get rid of some of this pain that I was experiencing.
In the last 5 years or so, have we had a much better understanding and collaborative care with physical therapy, OBGYN, urology, because I think now it is becoming more mainstream to understand that physical therapy is a part of those things.
Physical therapy can play a very significant role as far as endometriosis, especially when there's a strong suspicion, partially because of just how the tissues are connected together inside the body.
When you think of physical therapy for pelvic floor, I didn't know what to expect, but Julie's wonderful.
What we do encompasses everything from orthopedic type therapies, where we do stretching and we do muscle strengthening and we do postural control. And it might be for the outside, more external muscles that we're used to. We might do that for the internal muscles. And then we might look at connective tissue surrounding all that area. Women's health and all physical therapy, the collaboration between all of the other aspects of the network are super important.
I think a lot of times when we're busy, whether, in our roles, whether we're at work or, in our roles at home, we often ignore our own symptoms until they become too much to continue to ignore. And sometimes it's hard to know what is normal and what is not. So sometimes instead of trying to figure it out, it's better to just talk it through.
Living with endometriosis has brought me great sisterhood. I have met many, many women who have ended up being like family to me through the journey and through support groups and stuff like that. And that to me is a blessing. If I didn't have endometriosis, I would never have met those girls. You gotta keep fighting. Even if it's hard, you gotta keep going. Push forward.
Joining me in the studio is Dr. Holli Warholic, an obstetrician and gynecologist at St. Luke's University Health Network. Dr. Warholic, thank you for being here.
Thank you for having me.
So endometriosis can be a complex disease. What are some of the signs and symptoms that patients might look for to know to come in and ask their doctor questions?
So a lot of women will have severe pain when they have their period, and sometimes they have a very heavy flow with their period. Other women will have pain throughout the month that gets a lot worse when they have when they're going through their menstrual cycle.
And does it have an effect on childbearing and fertility? Is that something that if you have endometriosis you need to be concerned about?
So it can affect our fertility rates in women who have endometriosis. Sometimes it can cause scar tissue on the fallopian tubes, which could prevent you from getting pregnant. So it is important to see your physician to discuss these issues if you're thinking about having children.
One of the things that we learned from this piece was that there are a lot of alternative forms of treatment. There really isn't a one treatment fits all mentality. So walk us through some of the options that women with endometriosis might have and how that varying degrees of endometriosis might be treated.
Sure. So we have mild to severe endometriosis, and it doesn't necessarily correlate if you have severe disease, you have severe pain. Some women with mild disease have very severe pain, and sometimes we go in for another reason and we find endometriosis everywhere and the woman hasn't reported any pain, at least that's been problematic for her. So sometimes women can manage their pain with just non-steroidal anti-inflammatory drugs during the time of their period. We can do hormonal birth control to try and suppress the cycles. And sometimes we'll do continuous birth control where we're preventing the period from coming and only allow a period 3 to 4 times a year to help suppress that pain.
So you mentioned some of the medication treatment, but what about surgical and also physical therapy as we saw in the piece?
So surgery is sometimes used to treat endometriosis, and really that's the only way to absolutely diagnose endometriosis is to go in and visualize the endometriosis and take biopsies to get a histological look at the implants.
Now, you treat endometriosis as an OBGYN, and of course we know that you deliver babies, but what about all of the other care that women receive, really from their teen years through menopause? How important is it to have an OBGYN and see them regularly?
I think it's very important, and we do ask our patients to come in yearly, starting in their teen years when they're having issues with their periods, to when they're becoming sexually active or thinking about becoming sexually active and need birth control and STD screening. Then through the childbearing years as we help them prepare for a pregnancy, and of course the fun of pregnancy. And then after we're done with childbearing, we go into menopause, and a lot of women have a lot of complaints and symptoms with menopause or perimenopause that often they just kind of deal with because they don't think there are any options for treatment. So I think it's important to come in and talk to your doctor about the things you're going through because there are some things we can do to help alleviate those symptoms.
And what about screenings? I think that OBGYN, that field has so many screenings that are available for women to watch their health. What screenings do you recommend for women, and how important are they to get on a regular basis?
So after the age of 21, we do recommend pap smears, and right now we're recommending them every 3 years as long as they're normal. Mammograms, we usually start around the age of 40, and we do encourage women to get yearly mammograms as well. We encourage, routine breast exams that we do in the office, and we encourage women to examine their breasts at home as well.
As women, I think that often we put ourselves last. We put our families first, our job first, our children first, and ignoring symptoms can be a dangerous thing. What do you want to say to patients out there about listening to their bodies?
Well, we need to listen to our bodies because we are moms, we are wives, we are, very involved and important to a lot of people in our lives, and we have to take care of ourselves so that we're there to take care of our children and our spouses.
Excellent. Dr. Warholic, thank you so much for being here.
You're welcome. Thanks again for having me.
For more information on OBGYN services at St. Luke's University Health Network or anything from today's show, go to our website at thepeaktv.com. Thanks for joining us, and remember that every day is an opportunity to be your best self. This is The Peak.
Want to see more of what we do? Make sure to subscribe to our channel and give this video a thumbs up.